In this lesson, we're going to talk about the coronavirus infection or COVID-19. So we're also going to cover everything from the virology and the epidemiology, any testing, the treatment, and the nursing implications. So what you're going to be responsible for, and also patient education. So what is the coronavirus? Well, everybody keeps hearing this term COVID-19. Well, what is COVID-19? Well, COVID-19 is the disease that's been designated by the World Health Organization to describe the virus that causes the illness. What is the virus? The virus is known as SARS-CoV-2. So the sudden acute respiratory syndrome, CoV-2. So the CoV-2 stands for coronavirus 2. Now, the thing about these types of viruses, these SARS viruses, is they're also the one that causes just the basic cold. The difference is the problem with this one is that it has become so aggressive that there is, it's what they call a novel virus. This is one that hasn't been seen yet, and there are no preventative things on the market, and we'll get into that a little bit. But it's affecting communities at large, and here's where the problem gets even worse, is that it's actually started in Wuhan, China. And what happened was we had these patients that we were seeing for this common type of cold or this SARS virus, but because it's a novel virus, there's no immunity built up for it, and it ends up becoming pneumonia. It ends up becoming all of these other respiratory problems. It becomes sepsis. It starts to affect other organs, and then it becomes highly transmittable. So if we go back to Wuhan, China, it started around December 1st, 2019. And since then, it's actually, and today is March 6th. And so right around the last reported date, March 5th, 2020, in the United States, there have been 10 confirmed deaths, and there's been over 148 cases of this coronavirus, which has become a major problem. So let's talk about transmission and the patient population. Transmission is person to person. And what do I mean by person to person? Well, I mean droplet. And this is where it's so important. So if you have a patient that's coughing or sneezing, you need to make sure that you're taking the right precautions and make sure that whatever facility you're in, that they're exercising those right precautions too. The other problem is with the droplet, they could actually cough or sneeze onto a surface, and then it gets picked up on their hands, and then people touch the face and the mouth, and that's another method of transmission. So it's person to person, primarily droplet. So this is where your education comes in a little bit later. Now, what's the difference between COVID-19 and influenza? Well, influenza, a lot of people get their preventative measures. So they go and get their flu shot, and they'll get, they also have, everybody has a little bit of a built-up immune system for the common flu. And so everybody has the ability to fight this off. Even in some instances where patients don't have great immunity, they get their flu shots, they have at least a little bit of buildup of that immunity. Now, the problem with the COVID-19, because it's a novel virus, that's where it becomes a problem, is that there's no methods of prevention. It's so new, and it's becoming highly aggressive. And what's happening is it's also starting to affect these at-risk patient populations. So what populations are these? Well, we're seeing a lot in the geriatric patient population. So what are these types of patient populations? You've got your geriatric patient populations. They're either immunocompromised or they have some sort of pre-existing condition. So especially like lung disease or heart disease or cancer, or any other type of illness that's going to cause their body a lot of work. Now you're putting them in a position where they have some other comorbidity, and now they're getting this COVID-19, this coronavirus illness, and it's just causing all of these other problems for them. So let's talk about assessment. The incubation period for the COVID-19 is about 14 days. It can be up to 14 days. Some of the literature is saying anywhere starting around 2 days, but it can actually be somewhere around 5. So if you have a patient that exhibits these common types of symptoms, you can see a lot of the symptoms here, but the top 3 that you're going to see, the first one is going to be fatigue. They're going to be tired. The next one you're going to see is this shortness of breath. This is another big issue because it's a primary respiratory illness. That's where you're going to see it. And the last one that you're going to see is fever. These are going to be your number 3. You're also going to see some of these other ones. So if you have a patient that's been exposed to maybe an area where COVID-19 was found, whether it was in China, overseas, or in a highly populated areas where there have been known confirmed cases of COVID-19, that's where you're actually going to see a lot of these symptoms start to build up, and then this is where it becomes a major problem. So now let's go to therapeutic management. The biggest thing about therapeutic management is prevention. You can go through your patient education. We'll talk about patient education in a minute, but the biggest thing you have for your patients, especially in like a clinic setting where they're like, I'm concerned I'm going to get this coronavirus, this COVID. What can I do? The biggest thing they can do is wash their hands and make sure that they stay away from populated areas. Now, next thing that we can do is something testing. If there is a concern that a patient has the coronavirus, you can actually use these tests. There's something called a PCR test, and we'll get into kind of how we discontinue those. But the thing about this is it takes a couple of days, and this is where it becomes important, especially for those hospitalized cases that you know that you're going to have to hold on to them for a little bit, and you got to make sure that we get through that. So what are we going to do for our patient? Well, the thing we're going to do is provide supportive treatment. We're going to maintain their hydration levels. We're going to maintain their nutrition status. We're also going to maybe try to help them stave off those fevers. So we can use like acetaminophen or ibuprofen to help with those, try to make them comfortable. But the big thing is to make sure they're eating and drinking, all their systems are functioning, and provide the supportive therapy. If they end up needing IV fluids or that kind of support, that's another avenue that you can experiment with or that you can explore. In terms of experimental studies, there are a couple on the market because there is no vaccine out there. The problem is that we have to start to try some other things in the meantime to try to help reduce this prevalence of this illness. So what they're trying now are these antiretrovirals. And what these antiretrovirals do is they are used in things like the flu, other viruses like HIV. They're trying to see how well these work for these cases. In some cases, they're working. Again, it is highly experimental. Just know that if you have a patient that is testing positive for coronavirus and you are using these antiretrovirals, that's what they're being used for. Now, the big part about the discontinuation of your infection precautions, your droplet precautions, is that you're often going to pay attention to this testing. What the CDC is currently recommending is two negative PCR tests, and there has to be a complete resolution of all of their symptoms in order for them to have the discontinuation of the infection precautions. That doesn't mean that they can be discharged. It just says that, hey, we don't think that they're a concern. But the biggest thing here is you need to follow your facility policy, because that facility policy is going to pay attention to what the CDC says and also what the World Health Organization is saying. So just make sure that you're following those policies specifically, but these are kind of general guidelines. So patient education is where you can be of real value to your patients. The big thing here is prevention. You want to prevent the transmission by washing hands. Having your patient wash their hands, you washing your hands, having everybody that you know wash their hands is going to help prevent the transmission of this illness. The thing about it too is that, because again, if we look at things like the droplet precautions, because that means that it's a cough and those droplets are going to land on the surface. And what happens too, and we'll get to this in a minute when we're dispelling myths, is that anytime that cough is there, we want to make sure that we are washing our hands thoroughly. The other thing you want to do is avoid highly populated areas. And by doing that, you actually reduce that risk. If a patient is homesick, they don't feel well, that's another time that they should exercise caution there. Now, the other thing about that, I'm going to come back to that, is that if you have a patient that has those onset of symptoms, remember, we have the fatigue, we have the shortness of breath, and we have the fever. And let's take into account if a patient has been exposed to an area that has COVID-19, hey, give them a mask, which we'll talk about thoroughly in a second. Give them a mask, send them to the doctor. If you're if it's a friend or somebody that you know, and if it's a patient, get them a mask, get them to the hospital, get them tested, or have them seen by a provider. That's going to be the best thing that you can do. The mask is really important, but here is why. We're going to go to dispelling myths. The thing about the mask, when should a patient wear a mask? I'm sure that your patients are going to ask you this. So when should a patient wear a mask? The only time a patient should wear a mask with this illness is when they think that they are sick with it. The masks are not going to help people prevent themselves from getting the illness. Here's what's going to happen with that. Number one, they're actually going to buy up all of the masks. And by doing so, it actually decreases the amount of masks available for healthcare workers. This is a problem. So by having a bunch of people go out and buy these masks to hoard for themselves, and it actually creates a problem within the system. So by just explain to your patients, hey, don't go buy masks. You're not actually doing yourself any good. It doesn't prevent you from getting the coronavirus. Number two, the reason that you should try to encourage or discourage patients from going out and buying masks is because they are often, they need to be fit tested, especially the N95 mask. It's really common to go out. You can go to any one of your home improvement stores, and they have those N95 masks. But like if you're like me and you have a beard and it's not going to fit and seal right, it needs to be fit tested. So the N95 masks aren't going to work well. And the other problem is that people will reuse a mask. And by reusing the mask, it actually creates a couple of problems. Number one, they're constantly adjusting it because it doesn't fit well. And number two is that they are reusing something that potentially has either bacteria, or they have viruses, or they've been exposed to the virus and now they're taking their hands and touching their face with it, and they're potentially exposing themselves to that coronavirus. We don't want to do that. So if you have the opportunity, encourage your patients to wash their hands, to avoid populated areas, and they don't need to go out and buy masks because it's not going to do them any good. The other, another type of common question is are there any medications on the market to help cure or prevent the coronavirus? And the answer is currently no. There are some, like we talked about earlier, there are some experimental studies, but the thing here is that there are some future plans to get a vaccine developed, but there's nothing concrete right now. There are no medications. There are no preventative measures in terms of medication to keep people from getting it or to treat it. So it's all about supportive therapy. And the last thing about animals, a lot of people will ask, can my dog give me coronavirus? Can my cat carry coronavirus? Can any of my pets do it? Can my lizard do it? No, the answer is no. They're not carriers for it. So just be prepared that, hey, if that's a question you have, hey, no, you're not going to get it from your pet. All right, guys. So let's recap. The first thing about the coronavirus is we need to focus on prevention. This is the most effective way to stay healthy. Number two, droplet transmission is the most common type of transmission method. So we need to make sure that we need to avoid people that are sick. We're going to wash hands. That's going to be your best option in order for reducing that transmission. The next thing is treatment. If you are taking care of a patient, supportive therapy is going to be your best option. And then you don't be surprised if you are seeing some experimental studies like those antiretrovirals. Those are starting to be introduced, but we don't know. We don't have enough data on them yet to determine how effective they are. Then you have protection. Protection is going to be your best bet, especially when you're taking care of patients. Exercise, whatever facility policy there is, protect yourself as a nurse. If you think you need to do something a little extra, make sure you're following those facility policies and protecting yourself. And then the last thing is education. This ties back to prevention. You want to focus on prevention for those patients. Make sure they're washing their hands, avoiding those really populated areas, coughing into their elbow, staying at least 3 feet away to 6 feet away. That's sometimes not enough, but make sure you're staying away from patients who may have respiratory illness. And if you do think you do have a patient that thinks that they are sick with the coronavirus, have them seek treatment early. We hope that this lesson has been extremely helpful in understanding what's going on with the coronavirus. We love you guys. Now go out and be your best selves today. And as always, happy nursing.